Now, the basic physiology of the pain cycle is as follows. Say that a child is born with an overbite. During early childhood, they may or may not experience any symptoms. Possibly during teenage years, the child starts to develop headaches or facial pain or some of the other symptoms of head pain. They take an Advil or possibly get some prescription medication from their doctor. Later in adulthood, this same person can now develop worsening migraines and more chronic headaches. They go to the neurologist and they are prescribed certain type of migraine relief medications. What has been happening in this patient the whole time is an imbalance of their jaws, which has led to a slow wear and tear of the cartilage of the jaw joint. As this problem progressed, nobody has adequately diagnosed the problem, but has treated it with medications and other means to allow the patient to live comfortably. As the years go by, the chronic problem can become severe and life can become debilitating. Again, the problem has gone on without proper diagnosis. Now, when a patient has an imbalance or overuses their jaws, what happens over time is that the muscles adapt to the dysfunction by contracting at an increasing rate. The muscles actually believe that they are protecting the jaw joint and the jaws from the dysfunction by increasing the rate of contraction. Unfortunately, what this does is that it increases the pain and makes it more chronic. Unfortunately, what also happens during this increased cycle of muscle contraction is that the cartilage and the jaw joint begin to break down at an alarming rate. The muscles usually do not stop on their own without professional help. Now that you have hopefully understood the causes behind your head pain, let's take a look at what we do to get a proper diagnosis and a blueprint for treatment. Again, the most important aspect to begin our diagnosis is done with the transcranial X-ray. You can also have a physician or a dentist order an MRI for you. However, we caution you that if this is done, you must remind the technician that an MRI must be done with your back teeth touching together. Many times we see patients come in with existing MRI studies that are inadequate. The patient was simply not asked to bite down on their back teeth. If the patient did not bite their back teeth together, the MRI study or the transcranial study will not be adequate and will not provide the proper diagnosis. So, in order to provide a proper diagnosis, we must do a comprehensive examination for all of our patients. The first part of the examination starts with a complete muscle exam of the muscles of the head and neck in order to determine which muscles may be too tight or might be under a lot of hyperactivity. As we palpate the muscles of the head and neck, we ask the patient if they feel the muscle little, medium, or a lot. We push with a little bit of pressure, not excessive, and we ask the patient to tell us how they feel. Does that hurt little, medium, or a lot?
Medium.
What about that one?
No.
This one?
Medium.
This muscle?
Medium.
Here?
Medium.
Medium?
Mm-hmm.
Within the jaw joint itself, we often push around the jaw joint area to see if the jaw joint elicits any pain. Again, many chronic patients will not show pain within the jaw joint area itself. Do you feel any jaw joint pain as I push in there?
No.
Okay. What about these muscles here? Little, medium, or a lot?
Medium.
Again, the muscles are feeling most of the pain and dysfunction, whereas the jaw joint itself feels nothing. Pain there?
No.
No. We also examine the muscles of the neck, especially in the occipital areas. Does that hurt?
Yes.
Medium?
Medium.
Here?
Medium.
And here?
Yes, medium.
Medium. Here? Medium?
Medium.
Medium? Here?
No.
Medium? None? Okay. Here?
No.
Next, we have the patient stand up. The first thing that we look at is their posture. Again, we are very concerned with how the shoulders, the neck, and the head sit together. What is important to understand when we're looking at the head, sometimes you can consider it in simple terms. You can consider your head as a bowling ball. That bowling ball weighs about 9 pounds. If the head sits on top of your spinal column in a straight fashion, that head weighs 9 to 10 pounds. For every inch that the neck comes forward or the head comes forward, for every inch that the neck and head come forward from the rest of the spinal column, you are increasing the weight of your head by 10 pounds. In some patients that have very forward head posture, that head is actually putting well over 40 to 50 pounds of pressure on the vertebrae of the neck. We look at the alignment of the patient from different angles to determine how much posture and how much muscle dysfunction is present, because these become very important factors during treatment. Second, when we are done looking at the entire posture of the patient from top to bottom, we will perform certain nerve examinations to make sure that there is no nerve dysfunction, and also to gauge and see how the nerves of the head and neck are working. For example, I'm going to have you follow with your eyes only, and only your eyes, my thumb in these, and you tell me if you feel any dizziness. At times, we have to hold the patient because they get dizzy during these examinations.
Yes, a little.
A lot of the dysfunction in your eyes that causes dizziness or vertigo or imbalance, again, are caused by the nerves from the jaws that travel through the jaw joint and go to your eyes. Specifically, that is the ophthalmic nerve, the division of your trigeminal nerve. Next, we have the patient go into certain motions with their head from side to side and ask the patient if that hurts or not.
A little.
Many patients with dysfunction in their neck and their shoulder muscles are unable to do side-to-side motions or to rotate their head from one side to the other, or flex and extend their neck forward and backward. These tests alone give us an indication of how much the neck and the muscles that control the position of your head on top of your shoulders may be contributing to these problems. Next, we continue on with the nerve function. I'm going to have you wink your left eye. I'm going to have you wink your right eye. I'm going to have you smile to the left, smile to the right, smile both. Stick your tongue forward and relax. I'm going to have you close your eyes and tell me if you feel me touching you.
Yes.
Some patients actually lose sensation feeling to their chin or lip area or other areas of the head and neck because, again, the nerves go into such dysfunction, they lose the ability to sense. Next, I'm going to have you close your eyes for me. We also test the lower arm extremities to see if the patient can feel us touching them, make sure there's no other dysfunction coming from the neck and the shoulder muscles. Did you feel me touching you here and here?
Yes.
Yes. Next, we also press on the vertebrae of the neck, starting with your first cervical vertebrae, going to your second, third, fourth, fifth, sixth, and seventh, and ask the patient if they feel any numbness in any of their fingertips. Do you feel any numbness in your middle fingertips?
And this one.
Okay. When we do sense a dysfunction such as we just felt now, where we are pressing on the vertebrae of the neck, what happens is we are looking for a more chronic neck condition. These conditions can cause an underlying problem with the nerve pathways that lead to your arms and your fingers. When we palpate the neck and the patient tells us that they have numbness in their fingertips, our next referral will be to a neurologist or physical medicine specialist in order to have a neck MRI determine whether there are bulging, herniated, or degenerated discs in their neck. Some of our head pain problems that we treat can be solely caused by neck issues, neck dysfunction, and poor posture, so that must be addressed completely. Next, I'm going to have you tell me if you hear my fingers.
Yes,
We do a very quick test of hearing. And I ask you next, can you smell all your food properly, and can you taste your food properly?
Yes.
Okay, including lemons, oranges, chocolate, salt,
Yes.
a variety of spices.
Yes.
Some patients can actually lose the basic sensation of your basic foods and can actually lose their taste buds from the dysfunction of the nerves. The next step in our examination is done by using Myotronics jaw tracking and sonography equipment. The purpose of this equipment is to give us a full examination on how the patient uses their jaws, as well as to allow us to listen to the noises that are made within the jaw joint itself by the cartilage. Also, to a certain degree, the jaw track study allows us to see if there is a tug-of-war relationship between how the jaw functions and whether there are some existing neck conditions that may predispose the jaw to abnormal cycles of opening and closing. Chronic pain patients do not show any type of popping, clicking, or jaw joint sounds. Usually only people with minor problems, such as our TMJ patients, that open and close their jaws and they hear a loud popping and clicking, those joints can be heard through a stethoscope or simply by just listening to them. Now, if you've been to your physician or your dentist and they palpated or listened to your jaw joint with a stethoscope, that, for our chronic pain patients, is inadequate diagnosis. Only a transcranial X-ray and the use of the sonography equipment can help us to diagnose and see the extent of damage within the jaw joint itself. Remember, chronic pain patients have jaw joints that show no pain, make no popping, clicking, or any other type of sounds. Some of the patients that come to our office complain that they are losing sleep due to their pain, or at times they inform us that they believe they have some form of sleep apnea problem. One of the tests that we do for these patients is called an Echovision Pharyngometer test. This test allows us to make a determination whether or not the patient is predisposed to airway problems and possibly sleep apnea. We look at this test and we compare a few things. Number one, we look at the size of the airway. We also look to see if there is an obstruction within the airway, as well as to allow us to determine if the airway itself collapses when a patient falls asleep. If we find out any of these positive parameters for this patient, we will make a referral to a sleep lab, a licensed local sleep lab, in order for the patient to have a full sleep study. Chronic pain patients, head pain patients can have a problem with sleep apnea. We want to make sure that this area is not overlooked, and we do address it during all of our examinations. So now we can cover the basic treatment methods that we use to get our patients back to a normal life.